Thank you, Dr. Stratton Poulson, for joining us today. I appreciate your commitment to massage therapy as you've now become a chiropractor. I've known Stratton for several years now. I actually knew him when he was just a young pup. He was a very young green massage therapist going to the school that I attended in Dallas for massage therapy, and now he is a chiropractor. So thank you for joining us today, Stratton.
Yeah, thank you so much for having me. I'm happy to be here.
Stratton, tell us a little bit about you, who you are, how you got into the field that you're in.
Yeah. So before massage therapy, I was a martial arts instructor. And I started massage at 17 years old. And then I think I graduated right there around my 18th birthday and got licensed. So yeah, we went to school together. I used to work at Hands-On Approach, and that's where I went to school. So how I got into it, I'd always, as a martial arts instructor, I had always kind of like rubbed people's shoulders when they were hurting or when they were sore or someone would get injured. I would kind of try and like rub the area and help them feel better. And I remember one day I was behind the counter and I was checking some people out for some sparring equipment because I used to have to do some of the office stuff there as well as teach the classes. And I was making a joke and I was like, oh yeah, maybe I'll be a massage therapist. That sounds like a really easy job. I'll sit on the beach, drink Mai Tais, massage people in Hawaii. Like, that'll be great. I remember hearing a voice from behind me over my shoulder. It's like, so easy, huh? And it ended up being Russell Rust, who is the owner of Hands-On Approach School of Massage, which is where I went to school. And so I didn't know at the time that he owned a massage school, but so he overheard this and kind of was giving me what for about it. I said, well, if it's so easy, I got a class starting on Monday. Why don't you show up? And I did. So I used to teach his daughter martial arts. So she was in my classes. So I showed up on Monday and I had no idea what to expect or what I was really doing there, except that I had graduated high school about a half a year early, not because I'm brilliant or anything, just because that's how it worked out. And so I had nothing really to do through the back half of senior year of high school going into the summer. And then all my friends were going to college. And at the time I'd not planned to go to college. So I'm like, all right, well, I'd better do something. And trade school sounds like an okay job. And I was getting a little bit tired teaching martial arts and didn't want to end up there forever. So I started at Hands-On Approach and I worked there for my first year. That's where we met. I was a massage therapist for 13 years. I did about 2 or 3 of those years in the beginning in spa work and different kind of like gym settings. And then went out on my own on like my 3rd or 4th year and did about 10 years in what I would call private practice massage. And then went to chiropractic school. I was kind of looking for a next progression. So whether that was going to be physical therapy or MD or chiropractic, I was looking for how can I take this career or this kind of concept a step further, because I was getting a little bit bored of massage after that amount of time. And so chiropractic kind of fell into my lap. I got injured in jiu-jitsu and a friend took me to the chiropractor. And at the time I thought all chiropractors were crazy. They're witch doctors. Don't let them touch your neck. They're going to kill you, which is funny now in hindsight. But went to the chiropractor. They fixed me up. I felt so much better. And I was just amazed at the rapid change in how I felt. And so then I decided to go to chiropractic school. And so now I've been a chiropractor for about 1 year and 3 months. And I've been private practice doing that. Very similar to a cash massage practice model in terms of how I run my office. And I'm loving it. So that's kind of how we got to where I am now.
Thank you for sharing that. Awesome. Well, Stratton, tell us a little bit about how you've become successful in your practice. I see a lot of your videos coming across my feed on many social sites. I know you use social media a lot to help your business. Can you talk to me a little bit about that?
Yeah. So, social media has been 100% the biggest driver of the success that I've had in such a short time in chiropractic. And I think at the time that I was a massage therapist, it's not that social media didn't exist, but it was a little bit harder to get exposure. We were still doing like square photos or things like that on Instagram, and still images were kind of like the norm. So you might see someone post their holiday hours or like a photo of their office, and then you'd read through the caption, right? What's interesting about the way that social media has gone now is it's gone totally towards these reels, TikToks, YouTube shorts, these vertical content videos, and it's rich video content, right? Like it's engaging. It makes you want to continue to scroll and scroll and scroll and scroll. And so thankfully, chiropractic, I think a little bit more so than massage, is like quite visually dynamic, right? So you're setting a patient up, you're getting them into the position, you have the quick thrust application, there's a big popping sound, the patient's reaction. Just the way that chiropractic is done lends itself to being videoed quite easily. And so I've been able to take advantage of that by filming the sessions that I have where I treat many of my patients, those who want to be on camera. And then I post those to all the social platforms. So I post that to YouTube, I post to TikTok, Instagram, a little bit to Facebook. There's reasons why I don't do Facebook. It just doesn't seem to work as well for me as the other platforms. But you put those videos out, and that's kind of like your organic strategy, right? Which is just putting it out and seeing what comes back. Obviously, you might get a lot of views on something organically. It doesn't necessarily mean that you're going to get any new clients or any new patients from it. So the paired strategy that goes with that is that using that video as an ad. So you're running Facebook ads, Instagram ads, TikTok ads. You can even run ads on YouTube, although that's through kind of a similar format as like Google AdWords. And then you can geo-target your city. So like, I live in Dallas, Texas. And so I can geo-target the city of Dallas, or I can geo-target, 5 to 10 miles around my office, which is what I did in the beginning. And then you're showing your videos, which are already good because you know that they're performing okay in your organic feedback. So you take your best organic performing videos and then you run those as ads and try and attract patients in to come in to be a chiropractic patient, or you could do the same thing with massage to attract clients. I think with massage, it's a little bit hard because it's less visually dynamic. Like you would need to do either very like quick flowing strokes or something like pin and stretch techniques, or maybe Thai massage or something like that would be more visually dynamic. Cupping tends to be a good one. Or I have seen a few massage therapists make pretty good videos that is like a session and it's time lapsed and sped up, right? So you see them kind of like zipping around doing this whole massage, doing stretches and things like that. So you have to be a little bit more cognizant of making your videos visually dynamic with massage because it's just inherently a little bit less exciting. I always used to joke that massage is not a spectator sport with students when I was a massage instructor, but I definitely think that there are ways to do it and it can be done and it can be done well. And so the amount of success that I've had in the chiropractic practice purely from social media, that's the only marketing that I do, to me just proves that that is a fantastic way to do it. And I would, if it was me personally, I would never spend another dollar on like Google AdWords or any of those other types of advertising. I would rather double or triple my budget on social media marketing than go into any of those avenues.
How much money do you spend on this kind of advertising?
So I have two businesses. The first is my practice, and I spend between $1,200 and $1,600 a month on social media marketing. And then I have a separate business, which is my chiropractic online seminar business. I spend probably an additional $1,200 a month on marketing for those online courses. And, that is a big dollar amount. So like, it didn't start that way. When I first opened, I was running like one ad at maybe like $10 a day. So that comes out to like $300 a month, right? And that can start to go to work for you, right? Once you start getting a couple of good videos, you can tell that they perform well as ads and they're actually bringing in clients, then you can start to bump it up. And that's what I did. So then I was running 2 ads at $10 a day for $600 a month. And then it was 3 ads at $900. And it just kept going up in these increments of $300 a month. And as long as you're continuing to get people in the door and you're in the green in terms of like, you're getting, not only you have a revenue, but after you remove your expenses, you have net profit, right? Then it just makes perfect sense to keep doing it. And, I may actually bump up my marketing budget a little bit more just because, it's one of those things like, I can't remember who said it. There's like a quote, but it's like, trying to save money by not marketing is like trying to save time by stopping your watch, right?
Yeah.
Like the marketing is what brings people in and the people are the ones who have the money. So as long as you're getting a return on your advertising, dollar to dollar, if you're break even, there's no reason to stop doing it. And if you're profitable, there's absolutely no reason to stop doing it. You just keep ratcheting up that dial until all of a sudden you realize, okay, now we're overspending to our returns that we're getting. And then we dial that back down to kind of optimum. But that's where I'm at. So all in, probably 2,600, something like that between the businesses a month on just marketing.
Right. I mean, that does sound like a whole lot, especially if you're a one-man massage business. Spending that much money is probably 2 or 3 times more what we might pay for a room rental. So how do you know if somebody's coming in off of your social media? Do you have some sort of a hook that
So like, for example, how do I know that someone who's arrived in my office came from social media?
Yes.
Yeah. So in the intake paperwork that they fill out, like with their health information and what's bothering them and all that, I have a section that says, how did you hear about us? And there's a couple drop down options, and it's like social media. There's also a place where they can write in. So they could write in TikTok or Instagram or whatever. Or they may say like, oh, my friend referred me, or my brother or sister referred me. So I would say probably 85, if not more % of my patients end up writing social media in that column. But then I do get plenty of referrals from those patients, because the social media patients that come in, they all have friends and coworkers and family members. And so they start to give you more of those kind of word of mouth referrals that are the bread and butter of most massage practices.
At the beginning, you talked about how you thought chiropractors or quacks were, not reputable. And there's a lot of people that believe that out there. And as a massage therapist, I know I hear that from a lot of people. And, I believe, chiropractors are our compadres. They're people that we work with closely. I refer a lot of people to a local chiropractor that's around the corner from my office. If they're down in Dallas, I would definitely refer them to you, but I'm in Plano, which is kind of a pretty far drive. Yeah. So we refer a lot back and forth to each other. And, there are some people who just don't even want to have the conversation about chiropractic care. What would you say to those people?
Well, first of all, when someone tells me that they don't like chiropractors or chiropractors are quacks, I kind of just agree with them. It's like, because there are many chiropractors that I don't like, and I disagree with the way that they kind of do things. And there's kind of a long history of chiropractic, what we would call in our profession, chiropractic philosophy, which is the philosophical and intellectual underpinnings of what we do. And a lot of those core philosophies are outdated and old. They essentially had the founders of the profession in, the late 1800s, early 1900s, trying to grapple with, this therapy that they found of spinal manipulation and try and figure out why it worked. And so there's a lot of mysticism and kind of spiritualism baked into the founding philosophy of chiropractic. I think that is one of the things that gives us a bad reputation generally, right? Although a lot of the younger, because I'm 31, so I would consider myself a younger doc, but a lot of the younger docs in the profession have kind of moved away from that. Those philosophical underpinnings are more towards like an evidence-based type crowd, which is how I would consider myself. I consider myself an evidence-based chiropractor. So all that to say that I get it. When someone tells me they don't like chiropractors, like, hey, I don't like a lot of chiropractors either, so I'm right there with you. I totally get it. That doesn't mean that we can't help you. Doesn't mean that this chiropractor won't be able to help you. But, a lot of the friction from like the traditional medical establishment, so like, medical doctors and nurses, physical therapists, things like that, but specifically medical doctors, that goes back to early in the profession. There was a legal battle between the profession of chiropractic and medicine. And they were jailing chiropractors and accusing them of practicing medicine without a license for doing the spinal manipulations. And they were doing this all across the nation until there was an internal memo. And if you want to look this up, I think it's the AMA, American Medical Association versus Wilk or something like that, like the Wilk trial. But this is a founding piece of the split, the schism between chiropractic and medicine. So they were arresting a bunch of us for doing spinal manipulations, saying that we were practicing medicine without a license. And then there was a memo that was circulated among the American Medical Association, and it was called and in the wording of the memo, it said, we must work together to contain and eliminate the profession of chiropractic. And so that wording in that memo ended up being the basis for a suit, an antitrust lawsuit from the Chiropractic Association against the American Medical Association. And granted, I think we're somewhere in the mid 1900s here, so like 1950 or something like that, or maybe even earlier. So anyways, we chiropractors won that antitrust suit because it was found over the course of the trial that the American Medical Association was conspiring to eliminate chiropractic. And after that, that set up a legal foundation that created chiropractic as separate and distinct from the American Medical Association. And it gave us the legal protection that's allowed our profession to continue to survive. But it also drove just an incredibly deep schism between the two professions. And because of that, the philosophical underpinnings of chiropractic that are somewhat outdated, that many chiropractors still believe, combined with the historic kind of battle, has caused this huge schism between chiropractic and medicine, which is unfortunate because there are a lot of people that would benefit from massage, from chiropractic, from physical therapy instead of drugs and surgery and other types of interventions when they're not necessary, right? So always start with conservative care first and then escalate up the care ladder as things, either don't work or aren't working all the way. So sorry if I rambled a little bit there, but that's your chiropractic history lesson for you.
No, I didn't know that. So I'm very thankful that you shared that with me, because as a massage therapist, it's important for me to have this knowledge too, because I'm out there advocating for your industry as well as mine, and they are intertwined. And people do ask me, if he cracks my neck, is he going to kill me like in, this movie I saw? Absolutely not, but
Right.
there's that fear there. And I think, there is a lot of movies around people just go behind you and you're dead. And is that realistic? Is that even a thing that you can do? I don't think so.
No, it would be incredibly, so as someone who cracks necks professionally now every day, I don't know if I could crack someone's neck in a way that would kill them, even if I tried, right? Like it's a bit, your body is very robust. And people kind of think of their spine, they think of like a skeleton. They don't think like of the muscles on there. They don't think of all the deep and like very, very strong ligaments that hold each of those areas together. They don't think about the shapes of the joint surfaces that lock different segmental pieces of the spine into place, and the discs and how tough and thick. I mean, your intervertebral discs, they always get described as jelly donuts, which I hate because they're not like a jelly donut at all. They're like a truck tire that has been filled with like chewed bubble gum, right? Like they're this thick, tough, viscous, sticky, like material. So your spine is just incredibly strong. And your chiropractor would have to be just beyond grossly negligent in order to seriously hurt you in any type of way. Now, there are common kind of complications. So one of them is, especially in osteoporotic women, the chances of fracturing a rib during an adjustment are much higher. It is possible to fracture a rib when you're adjusting someone. I've unfortunately had 2 rib fractures in my career so far from adjusting people. And there are techniques that you can use and ways that you can, try to minimize that. Now I know, the patients who are at more risk, and we use more low force and more, what I would consider safer techniques for them. There are things like that. The most common complaint is a little bit of muscle soreness the next day because we went in there and moved that joint. Stuff like that is normal, but the very serious adverse reactions are incredibly rare. I mean, we're talking about to have a stroke or something from getting adjusted. You're more likely to go outside and get struck by lightning on the way home today than you are to have a stroke getting adjusted by a chiropractor. And the research, backs that up in terms of incident rates. So there is a perception that chiropractic is inherently dangerous or scary. But I think if it really was that dangerous, you'd be hearing about chiropractors killing people in the news all the time. Because I adjust anywhere between 25 to 35 people a day, right? 400 patients probably a month, if not more. So that would be a lot of dead people if chiropractic wasn't so.
That's a lot of adjustments every week.
Yes.
Wow. You talked a little bit about JNAP. Tell me a little bit about that. I mean, it sounds really interesting from a massage therapy business point of view. I had never heard of it before. I use Vigaro. In the past, I've used Mind Body, which is really expensive for a small business. There's Schedulicity. I've used that before, but this is one I haven't heard of. And I'm very interested for our listeners to hear what you told me about it.
Yeah. So JNAP is great. It's similar to like a Mind Body or something like that. They are a Canadian company. And I think they originally started with like physician's assistants and like nursing, and then moved into chiropractic physical therapy. But as a massage therapist, so first of all, my practice could not run without Jane. Like Jane app is the only reason that I'm able to run my practice the way that I do. I don't have any staff. I don't have any front desk staff. I'm completely solo. So very similar to a solo massage practice. Like you go up, you greet your client, right? You bring them back. Hey, what's up? What's going on with you? I saw that you put this under your intake paperwork. You do your session, you take your payment, you check them out. So that's how I run my chiropractic practice. It just has to be very efficient because I see many more people per hour compared to massage. But what's really cool about Jane app is it is an EHR system, so electronic healthcare records. So you don't have to have any paper records. So you can do all your documentation, your soap noting in it, right? In addition to that, it also includes online booking so that people can go online through your website, find the times that are available and book different services. So if you have different levels of services, they can choose what level they'd like to book and choose a time that works for you. They also have integrated payments. So you can put a credit card on file for the patient when they sign up. If you want to charge a deposit to hold like a 2-hour massage appointment so that you don't get screwed if somebody no shows, you can do that. And when the session is over, you can take payment with one click right through the app based on the card that they have on file. So that's really cool. And if that wasn't cool enough, they also have automatic email and text message reminders. So you can set kind of the duration. Usually for me, I'll send them an email appointment reminder the day before that they've got an appointment with me. They get a text message reminder about 3 hours before if they have an appointment with me. And that helps dramatically reduce your no-shows. And you're like, oh no, I forgot. I'm so spacey. The holidays have got to be crazy. Those clients, right? So it helps reduce that. You can do all your charting in there. And it's really fantastic. So the whole flow throughout the day is like, as you have the patients all on your schedule or your clients all on your schedule, when someone arrives, you just click that they've arrived and then it knows how much that session costs and puts that as a balance on their account. Then you do your session. Then when you go to check them out, you just click pay. It pays for the session. You can rebook them in the Jane window on your computer, or they can go online and book for the next time that they want to come back in. If you sell packages or memberships, it will track the number of uses on your packages, which is tremendous. I mean, for me, I used to have like a whole tally system or like a punch card system, and just tracking memberships was awful. So a lot of times I wouldn't do memberships or wouldn't do packages because like, no, just come in. It costs this much to come in. We're done. Right.
Right.
But with how easy it is to track the packages and memberships in Jane, that makes that very, very frictionless for you as the business owner. And you can do every aspect of that. And then once the client leaves, you can then digitally do your soap notes. And so what's cool about that is you have no paper records. So when they book their appointment online, it sends them an email to fill out their intake form. So it's like everything that's going on with them, what's bothering them, their basic health information, all that. So you'll have the digital intake form there for you to look at before they arrive. And then you can add in a digital soap note into their chart. And every time they come in, you can generate a new soap note and you can track their progress over time. And it's all HIPAA compliant. You don't have to worry about storing them because they're stored in the cloud. And let's say you have a client that you've had for, 5 years, right? You can go back session by session in history and see how they were doing, what they were doing, what was going on with them. So what's really cool is I use the insurance version not because I take insurance, I don't, but there's a billing and coding aspect to that. The insurance version is like $100 a month. And there's a cash version, which doesn't include that, which I think massage therapists would be perfect for the cash version. I think it's like $75 a month last time I checked. Don't quote me on that, but yeah. So the system is called Jane app. I vastly prefer it to MindBody, which I've used before, and even things like Vagaro and stuff like that, which they're online schedulers, which is convenient, but they don't have any of those other features. So you're still taking payment somewhere else. And Jane has all your account keeping as well. So you can go in there and pull up reports of your revenue, how much you got paid each month and things like that. So if Jane is the only place where you're taking payments, then at the end of the year, when it's time to do your taxes, you just print off your 2022, revenue sheet, and there you go, right? You have your taxes ready to go.
Awesome. Thanks for sharing that. I mean, I want to let our listeners know that we're not getting paid by any of these companies to mission.
Oh yeah, we should be, right?
Right. We should be. There's no referral bonuses that neither Stratton, I'm assuming, or I am getting. We're just out of the kindness of our hearts sharing this information that has worked for us. Right. So I want to make that clear. nothing against Mind Body, Vigaro, Schedulicity. They all work very well as well. But I wanted to share this app that I'd never heard of. And maybe you'd never heard of it. So there you go. Stratton, I want to ask you about being a male in your industry. I think as a massage therapist, it's a lot more difficult. I think as a chiropractor, it's probably a little easier for you as a male. I don't want to put words in your mouth, but from the male massage therapist listener out there, what advice can you give to help be successful?
Yeah. I think, chiropractic has been historically predominantly male. And so now it's just like, yeah, it's status quo, right? It's like you go see the doctor. It's like, there's Dr. Poulson. Yep. He's a guy. That's what I was expecting. And off we go. So it's really not an issue at all in chiropractic. Although chiropractic is becoming much more female. When I was in school, about 50% of my class were female chiropractors. So there's a big push to get women into chiropractic, but it has been historically like an all boys club.
I'm happy to hear that. I really am happy to hear that because I do believe that there's a need for female chiropractors in the business. And on the flip side of that, I do believe there's a need for male massage therapists in our business as well, where massage therapy is a female dominated industry and chiropractic is a male dominated industry. I think there's enough business for everybody. And I do believe that it is something that's needed, but I don't know that people understand why we need male massage therapy, I guess.
Yeah. Yeah. I think being a male massage therapist is difficult, especially in the beginning of your career, and especially when you don't have that much experience or confidence in yourself. And so you're kind of a fledgling therapist. You're trying to get your feet underneath you, and you're more than likely working in a spa environment because most of us end up taking our first few jobs in a spa environment. And it's just not well suited to men, particularly me having the experience of being a young male and then being in Texas, right? So Texas is a more conservative kind of place. And at the time, especially the climate 13 years ago when I was younger, what I always used to say is that women don't want a male therapist because they don't want to get hit on, right? And then men don't want a male therapist because they don't want to be touched by a man because that's gay, right? And that was very much the mindset 13 years ago. It didn't matter if you were gay or straight, right? The men didn't want to be touched by a guy because they were homophobic or just, they didn't want that. And then the women were more comfortable with another woman because there's no chance of, well, not that there's no chance, but they're less likely to be hit on or sexually assaulted and things like that. And so those two, I think, fundamental driving forces are what makes the initial journey into massage difficult for men, is because you're then having to overcome that initial impulse on behalf of the client. What I will say is that that's definitely more pronounced in spas and at like lower level spas. So we don't have to name any spas specifically, but there's like entry level tier. There's like another like more mid tier. And then you get up into these like fancy hotels, fancy gym spas. Those are like the high tier. Then you have other settings like the gym. So typically in your entry level positions, being a male therapist is going to be harder. The female therapists tend to be fully booked up while you're, trying to scrape together 4 massages to make your day worth it, right? As you get more experience, you also develop more clientele, and that gets a little bit easier. But as you move up into the higher tier establishments, it becomes less of an issue as well. So when I worked for a while at Equinox, which kind of has 2 benefits because it is a spa and it's a higher end spa. So that made things a little bit easier, but it's also in a gym, like a very fancy, like luxury gym. And so that's where most male therapists, I think you likely want to be aiming your career towards gym or athletics in some capacity, because it will make your life easier. Because when you're dealing with injuries or you're dealing with people who are, athletic or in the gym, your gender is much less important, and it can actually work for you. Because most sports coaches are men, most physical therapists are men, most chiropractors are men, most doctors are men, right? So to be a supporting staff for an athlete and to be male is expected. And so if you want to kind of fast track that, and that's what it did for me, is it kind of fast tracked me getting over to where it was less of a problem. Working either with CrossFitters or working with people who are athletic or something like that in that capacity as a male, I think is a good idea. Now, you don't have to. If you are a man and you absolutely love like Swedish relaxation massages, you're going to build a great career. It is just going to take some time. And especially if you live in a conservative area, you have to realize that you may have some pushback from clients over your gender. You just got to let it roll off your shoulder, right? Like it's fine. Some people, you know, want a male therapist, some people want a female therapist. Everyone has their preferences, and you can't do anything to change that. But you can do some of those things to set yourself up. So working in a higher end setting where people are generally more understanding, less judgmental can help. And then we're getting yourself into a sports, and it doesn't have to be sports specifically, but active lifestyle, gym lifestyle adjacent. So this could be Brazilian jiu-jitsu, CrossFit, it could be rock climbing, anything like that, anything where we've got an active population. Because when people actually have problems, they just want the best therapist, right? If I want to have a nice relaxing massage, maybe I don't want a man to give it to me. But if I want, someone to fix my neck, which has been killing me for 3 weeks, right? I don't care. Give me whoever here is the best at fixing necks is generally where people come from. So.
Yeah. I mean, on this podcast, we've talked a lot about making your client feel comfortable in every setting. And I think whether you're male or female, it doesn't matter. You want to make your client feel comfortable no matter what. And, I'm not going to say you can't change your gender because you can, but, you might not want to go to that extreme to be a massage therapist, and that's okay. But I think as long as you can make your client feel completely comfortable, and as much as you can, if they have prejudices around a sex or a gender, that's not something you can really change about that. But you can make them as comfortable as you can. I know some male massage therapists will ensure that their clients know that they're married, that kind of sometimes allows, especially a female client, to be a little more comfortable.
A lot of things like that. I think, the thing that you can't really control is like in the booking process. If someone calls in, who's available. Oh, well, Jason, like a stereotypical male name. Oh, I don't want a guy, right? Well, there's nothing you can really do about that because you're not going to be able to make someone comfortable on the initial phone call. Now, maybe if you're working for yourself, then yeah, like the way that you answer the phone, like, hello, you've reached, Stratton Poulson at da-da-da massage. How can I help you today? Having a relaxed tone, approachable, easygoing, then you could start to kind of to work with people like that. But yeah, I think sometimes male therapists will get discouraged at having a low schedule. And then they'll almost begin to lean on the fact that they're a male and a female dominated industry as like a crutch for why they're not being successful. And I would encourage any of our male therapists that are listening not to let that be you. Because you can sit there, I don't know if I can curse on your podcast, but I'm about to. You can sit there in the back and you can bitch and moan and complain that you have an empty schedule while the women are all booked. Or you can do something to fix it, right? You can go out there and try and actively seek out clients. You can try and get yourself into these more sports-oriented activities and communities and build yourself a clientele that values you for who you are. And that also comes into like, don't commodify yourself, right? If you can imagine 10 therapists sitting in the back of a spa, someone comes in and says, I want a massage right now, right? Well, which therapist do you want? I don't care, right? It's a commodity. Like it doesn't matter which therapist comes out of the back to that patient. So, if someone comes out and they don't want a male, it's not going to be hard for them to be like, oh yeah, well, give me a female instead. So you want to put yourself into a position where you're not competing with literally anyone who's capable of giving a massage. And so that can come into like certifications, specialities, if you are more sports oriented or you've taken more like trigger point, do tissue myofascial classes, you do like orthopedic massage, things like that. That starts to set you apart to where you're not just this, oh, I'll take a massage from anyone at 2 p.m., right? To where I'm specifically looking for Jason sitting in the back because Jason is the best deep tissue therapist I know of here. And so that's what you got to do. So you got to start really doing excellent work, making your clients comfortable and letting the reputation that you develop through your work for you. Instead of, I see it too much sitting in the backs and spas with all the men just commiserating. And it's like, go and do something to fix that for yourself.
I love that. That's awesome. Get off your ass and do some work. I mean, find yourself your niche, your speciality that makes you different than massage therapist A and B, whether they're male or female, doesn't matter. Like you said, I want Jason because he's going to fix my neck,
And there's so many settings too. I mean, law enforcement is like primarily male, so you could do something like that. Gun ranges, if you like to shoot at all, that's a great place to meet people who might be, less resistant to a male therapist. Like there's lots of these places like CrossFit, jiu-jitsu, police, hockey, like baseball, all these sporting type things. You can probably get in, find some people that need your help and won't care that you're male. But it is going to require putting yourself out there.
And to be honest, this is good advice for female massage therapists as well. If you are a cyclist, if you're a boxer, if you're in Pilates, whatever your sport of choice, activity of choice, hobby of choice is, whether it's nature walks, bird watching, cycling, it doesn't have to be a gym. I mean, fortunately, Strat was already in. You were already in Brazilian Jiu-Jitsu, so you already had connections there. If you already have connections somewhere, use them to your advantage,
Absolutely.
Okay, so my husband, here's a side note. My husband plays darts, and there's the people that sit and do this all day long. I'm throwing a dart right now is what I'm pretending to do. That motion is a repetitive motion, and it may not be considered a sport or an athlete kind of situation, but that particular movement causes issues. And I have some people on the dart team that come to see me because they have problems with that arm and throwing darts. So, do what you can do to utilize the groups that you're involved with, right? I mean, it could be bird watching, it could be dart throwing, it could be Brazilian Jiu-Jitsu, anything at all. And you don't have to necessarily be male to utilize those skills to build your business or to build your massage therapy practice or to bring people in the door to see you.
And the key there is just when you go do those activities that we're going to do anyway, make sure that you open your mouth, right? Like make sure that you're talking to other people. And one of the easiest ways to do this, if you're afraid of talking to other people, or, well, how do I even bring up that I'm a massage therapist? Most people will reciprocate a question that you ask. So if you're meeting someone for the first time, you're talking, hey, what do you do for work? That's what you'll ask them. What do you do for work? And they'll explain what they do and ask some questions like, oh, that's interesting. So like, does that involve more of this industry or that? Or how do you like that? Da, da, da. What typically happens is that will reach a natural endpoint. And that person's usual inclination is to then in return ask you what you do for work. And now you get to go on your whole little massage spiel pitch, ask them, have they ever been to a massage therapist before? Oh yeah, I love this massage therapist that I go to, or, oh, I actually haven't been, or, oh, I'm looking for a new one because it moved to the area, right? But that's a natural progression to that conversation. So start by asking people questions about themselves. And then when they reciprocate and start asking questions about you, then you can bring up massage and it won't feel forced or salesy or weird. And especially like, keep it conversational. Don't launch into your 30-second elevator pitch that you've practiced that sounds awful and you sound like you're trying to sell massage, right? Just tell them that you're a massage therapist, tell them where you work and the types of work that you do and go from there. So the other thing that you can do is if you have your own brand is you can wear your own branded t-shirts, right? So I do that a lot. We're all wearing, let's just wear it right now. Yeah. I'll wear like an Apex Chiropractic t-shirt. And when I go out places, and it doesn't happen often, right? But occasionally people will ask me, hey, what is this, logo or what's going on with like, what's your shirt? And I'm like, oh, this is my business. And you get a chance to talk about it too.
Yeah, I agree. Completely agree. Can you think of any other advice or anything you've learned over the years in your business practices that may help our listeners make it through every day?
Yeah.
I
think one of the big ones for me when I had my massage practice was like strategic partnerships, which is like these referral relationships that we talked about. Because if you're not sure about content creation or making videos or being on videos, and I get it, like it's a big ask because you have to if you're going to talk about a condition, you got to talk to camera, not sound stupid. Like, you got to make the scene look okay. You got to get the lighting right. Like, there's a lot of work that goes into content marketing, whether you're filming treatments or, talking head video. But referrals are kind of the way that everyone's done it, bread and butter for forever. And so one of the things that I did that really set me up super well is when I moved to Dallas, because I used to live up closer to Denton. When I moved to Dallas and I had opened my massage practice, I spent some time searching for all of the yoga studios, all of the CrossFit gyms, all of the gyms in Dallas that I could even get Google to tell me existed. And then I slowly went through website by website by website, and I deleted any yoga studios or anything like that that already had a spa or massage therapy on site. So now I've narrowed it down to CrossFit gyms, yoga studios, and things that don't have on site. And then I got rid of any website where it wasn't particularly easy to find an email address, right? So now I have, I don't know, 80 sites, right? And I took all those emails and I crafted just a general email. I was like, hey, my name is Stratton Poulson. I'm a massage therapist specializing in deep tissue and trigger point work. I work a lot with car accident clients and a lot with CrossFitters and amateur athletes. I would love the opportunity to speak with the owner, potentially give you a free massage so that you can attest to the experience, and then offer your membership a 20% discount on services here to be your massage therapist. And I sent that email out to like a ton of CrossFit gyms and a ton of these different places. And granted, you send that out and only a few are going to come back. But of the few that came back, I think I gave out like 4 or 5 free massages to owners of different establishments. Some of those ended up working out. Some of those didn't. But one relationship that it did land me was Tyler Nicholson, who was the owner of CrossFit 214 here in Dallas, just since closed. And I think Tyler moved to Colorado. But for probably 5 or 6 years, more than 50% of my client base were CrossFit 214 members. And it's a win-win because what I said to him and said, look here, I'll massage you for free, maybe once a month or something, whenever you bust yourself up because you're the owner. And then you can sell as a benefit to your membership. So as a member of CrossFit 214, you get this 20% discount at, Stratton Poulson's massage place. I was calling it Apex Health and Fitness at the time. And so what's cool for the owners, because that then gives them an extra thing that helps make their membership worth it. So when they're talking to members, like, by the way, you get discounts at these massage places in exchange for being a member here at the gym, which you're going to do anyways. And then the members are stoked too, because there may be massage therapists that are closer to them. There may be massage therapists that their friends have heard of, but you offer 20% off, right? And just, figure out whatever your rate needs to be so that you're not going to have the lights go off because you're giving away massages for free. But that worked super well for me. And if I had never spent the time to do the research, sent those emails, given away some free massages to owners of businesses, that never would have happened for me. And that clientele got me through some difficult times where, because every once in a while it just happens, something gets into the air and all your clients just disappear, right? Like it happens, especially around the holidays. It gets rough like that, right?
I mean, like a pandemic?
Yeah. Or it's, some completely global virus. Yeah. So things are going to happen, but that clientele from CrossFit 214 consistently over the course of many years helped keep my business alive and helped me make the income that I needed to make. And so it was just that one decision that day to put in that work and to give away some free massages that paid off tremendously throughout the entire back half of my massage career. So my advice would be, look for ways that you can develop strategic partnerships like that, and just be very practical in your approach. Like, hey, I know that you own this place. You don't know me from, Sam down the street. Let me give you a free massage. If you like it and you think that, you want to work together in this way, then great. And if not, no harm, no foul. We can both go back on to not knowing each other like we did before. And I think when you do it that way, business owners are much more open to that because, I personally would not sell or recommend anything that I didn't personally like and experience. And so I do think you need to find those people and let them experience your session so they can personally speak to it and resonate with it.
I completely agree. And, it sounds like a lot of work, and it is a lot of work. And, one of the things that I've found in my business that has been really helpful, that's along the same line, are my clients actually telling me, hey, you need to know Knit at the PT that I go to down the street, where you really need to be connected with, Dr. Brady, the chiropractor. That's how I found the chiropractor around the corner from me. And that's probably one of my best referral sources is the chiropractor. He'd been looking for a massage therapist to refer people to for years. And all I needed to do was just, hey, hi, I'm here around the corner. I work on already 5 of your patients. Did you know that? I'm Julie. Nice to meet you. And that's all it took for me. It was really, really easy. And my clients, you develop a relationship with your clientele over the years, right? And those people want to help you grow your business. And that was a surprising benefit that I found with my clients that they were like, you really need to know these people. They're part of our healthcare team that you're part of my healthcare team that works with all these people, but you don't know each other. And I would like you as your client to know everybody that is working on me. And I appreciate that. And it's
100%.
and some people are a lot more open to talking, than others. Some PTs or chiropractors or whomever are like, or gym owners might not have any interest in talking to you. And like you said, that's okay. We can go on not knowing each other forever. But, sometimes those same people end up coming back to you later and going, yeah, I found out that all of these people need massage and I was too hesitant to just blow you off.
We'll come back. Hey, things have changed.
Yes, things have changed. Your name has come up to me a few times. Other clients have said, oh, yeah, Julie's awesome. You should go to her, or whatever the case may be. I think it's really good advice. I really like. We've talked about mentorship, apprenticeships, or mentors on the show, but collaborative efforts around other people that are simpatico in our industry, chiropractors, included. I think it's important. Gyms, things that may be collaborative for you to help those people, even if it's, a dart thrower over a bird watcher.
I think the important thing too is when you're doing these outreaches or when you're trying to is just to be very reciprocate well and be very genuine, right? So, you could have a client that tells you that they do yoga in a particular studio with a particular instructor. Well, go try out a yoga class there and then have like a genuine introduction to the person, right? Or if your client uses a particular personal trainer, maybe you schedule, a training session. It only has to be one, but you meet them, you go through, you meet them and you do their flow. Or maybe you go meet a chiropractor and you become a patient. Like you go in and get an adjustment. Like you don't have to sign up for the entire suite of care, right? You don't have to get a package of personal training, a package of chiropractic adjustments. You don't have to buy a yoga membership. You don't have to start training Brazilian jiu-jitsu for the rest of your life, right? But when you're going to go in and approach these people, you should patron their business at least once, build a genuine connection and introduce yourself and then explain what you do and how you think that y'all could work together. Because you want to avoid walking into someone's business, shaking their hand, telling them about how much you're going to help their people, like basically how they're going to help you make money is essentially what you're telling them. And then walking out having given nothing or engaged not at all with their business. Because unless your offer is just really compelling or they really like you as a person, no one has any reason to do that with you. And people will feel somewhat obligated to take you more seriously or at least give you a little bit more of a reasonable amount of attention if you have first patroned their business and kind of shown a genuine interest in what they do. Then people are much more likely to reciprocate.
Yeah, I totally agree. You don't want to go in there full force selfish. Like, how can you help their business as well? I really like the offer that you gave the gyms and said, your members can get 20% off. When I was building my business, I would have special cards made up. And on the back, it said, your first session is half price. And that was a teaser, and I would pass them out to all the businesses in my surrounding areas of my office and say, this is special to all of your clients can come in and for their first session, get that half price. And I purposefully did that because I wanted to make sure we were a good match as client massage therapist, right? Because if you come in to see me and I'm not for you, that's okay. You're not in for very much money. You're half price in, right?
Right.
And, we maybe wasted an hour of our time, but, was it a waste? Now we know that it's not a match or it is a match. And now I have a client, because they're hooked. But yeah, I love this. I love the communication we've had so far. We've covered a lot today. I'm so thankful for all of your great tips and tricks and your knowledge and we got a history lesson in chiropractic medicine and where that derived the how do I want to say this? That
The clash between
class.
medicine and chiropractic and kind of
Yes.
where that came from.
Yeah, exactly. And that's important for us to know to help overcome that, to be a part of the team that helps overcome that in our history, right? And I think that's important for
And
massage to be on your team.
it's changing a lot too. And just to put it in perspective, right? Like, people would feel like, oh, well, all the medical doctors hate chiropractors or think they're all quacks. It's like, I did my residency at the Dallas VA hospital along a team of MDs. And every single patient that we saw at the chiropractic clinic at the Dallas VA was referred by their medical doctor specifically to the chiropractic clinic. So it's not like all MDs hate all chiropractors. It's not like no chiropractors work in the hospital setting, things like that. It is changing. But there is this kind of like long-standing historical infighting. And for a lot of MDs, they are being brought up through their education to be very hesitant towards chiropractors. Really all non-traditional Western medicine type practices. So I do think massage therapy can get lumped in there where they're like, oh yeah, do it if you feel like you like it and it feels good, but it's not good for anything, right? I've heard MDs say that about massage. And we know, obviously, that that's not true, but that can be the attitude sometimes. So, but I think things are changing. I think generally a lot of the professions are becoming much more collaborative, much more accepting of other approaches. And, I don't think there's that like too many cooks in the kitchen type mentality that people used to have where like, if my client or my patient goes to get a massage, I'm not then worried about what that massage therapist is doing and if they're going to mess my patient up, right? And if my patient goes to physical therapy, I'm not worried that the PT is going to mess them up, right? And I think we all need to have that mindset, right? Like your client going to the chiropractor isn't going to break them and mess them up. If they go to PT, we're all doing our best to help that person, and just play your role and do the best that you can every time that you have a session with a client, and you'll be good.
I think a good way to end this section, because I think, our whole motto in healthcare is do no harm. And I think as long as we keep that in our minds as we work on people and focus on their best interests, I think you can't go wrong and you can be successful if you keep that in mind. All right. Thanks, Stratton. I appreciate it.